welcome. Thank you for joining us. It's a pleasure to have Professor Emmanuel Chartier-Kastler with us today to discuss a very exciting study, the SOPHIA trial, which you've been involved with. But it's a pleasure to have you here as a kind of godfather of functional urology, speaking to us about various aspects. So it would be good really to focus first of all on this really exciting study you've been involved with. And it's about an alternative to the current artificial urinary sphincter. So could you tell us a bit of background about why you decided to do this study and what it involved?
Yes, thank you for your nice welcome and your nice words. Yes, definitively we are working on a new device because we are used to use the current device, which is an hydraulic one with a pump placed in the major labia in women or in the scrotum in men. And with time we had the idea that some troubles of this device could be solved or improved. And I will give you some. For the patient, palpating the scrotum or the major labia is not always very nice, and some patients complain about it, even if they are continent and if the prosthesis is working. Secondly, the current prosthesis doesn't adapt its pressure to activities, and as up-to-date knowledge, we know that electronic may help. That's why we went to the idea that we could suppress the pump and also suppress the balloon. And such a way, with a three-piece device in the past, we could have one hydraulic piece, the cuff, and one electronic piece, the occlusive unit, which may have all components, which means the pump, the liquid, and the pressure sensor.
Yeah, wow. I mean, it sounds very exciting. And tell us about the study that you've been piloting recently and that you're presenting here at EAU. A bit about the study design and the key kind of outcomes.
You are right. Developing a new device is a big challenge because not only you have to think about working with engineers and new ideas, but you have also to think about the clinical development. And first, you have to show safety of the device. And following French regulatories and also European and American rules, we had to start with a pilot study which is aimed to be sure that there is no safety issue regarding implantation and the working process of the device. So 6 men were included in the SOPHIA study. 6 men were included to be implanted with the cuff at the bulbar level. All these men suffering incontinence after radical prostatectomy. None have been irradiated. And the objective was to follow them 6 months and then 12 months to check if there was any clinical issue or any failure with the device. At this moment, we present 6 months data because the abstract has been sent with 3 months, but we have 6 months now. And I can say that all patients have been activated and are at the level of the safety and continence level we would like to reach.
Wow, very impressive. Actually, one thing you mentioned really stands out is the fact that you can adjust the cuff pressure. Is that correct? And what is the range over which you can adjust the pressure?
It's a very good question. It's a key point because if you just look for the current device, we don't know exactly what is the pressure inside the cuff. We know that we use the pressure regulating balloon, the PRB, which usually is a 61 to 70 centimeter of water following international guidelines. But it doesn't mean that the pressure in the cuff is at this level because inside the patient, inside the body, there is also abdominal pressure or pressure when you are sitting. So at this moment, we are able with the electronic system to increase pressure slowly, step by step, following the continence achievement of the patient and not going up to a limit which we think will be probably 70, 80, 90 centimeters of water because the key point today is, do we know exactly what is the pressure inside the cuff with the current hydraulic system? And it's no.
Yeah, absolutely. Yeah, great point. Well, I think, it's a very, very exciting thing for the future. I think it sounds very interesting. While I have you here, I just wanted to ask you one other question, a bit more general, because you've been innovating in this area for, decades. You continue to innovate. What do you think over the next 10 years? What do you think is going to be the biggest development or innovation in functional or neurourology?
It's so difficult to predict what will happen. I have the chance to have now 30 years of career, and I saw fantastic developments like botulinum toxin A and neuromodulation. I don't know if some urologists have been so happy as I am to see such new drugs or devices. For the next years, definitively regarding surgery, the quality of surgery is improving with the robot. Whatever you do, bladder enlargement with bowel or implantation of artificial urinary sphincter in women, we see that the robotic surgery is going to improve quality of surgery and quality of recovery period for patients. Yes. That's the first thing. The second is with electronics and AI, artificial intelligence, we cannot predict what will appear, but I'm sure we will have better and quicker knowledge about the follow-up of our patients, and so we will be able to react more quickly if there is any side effect of any device or any surgery. And I just think to the mesh story. The mesh story should be more short regarding complications. If we should have in the past a better national and international follow-up of quality of life and complications.
Yeah.
So I hope the future is related to artificial intelligence, quality of surgery because of robots, but it's more telesurgery, and definitively with new artificial urinary sphincter.
Excellent. Well, thank you so much for joining us. It's fascinating to talk to you. Really enjoyed it. Very good. Thank you very much.
Thank you very much.